Hello people, in this video let us look at the cardiovascular adaptations in pregnancy. So the normal adaptations that happen to the heart and the blood vessels in pregnancy based on trimester by trimester what changes. Okay, so this question had come in the annual MBBS exam for me in obstetrics, so please pay attention here. So I think you already have guessed what will the heart do. The heart will pump more blood, correct? It will have more cardiac output. The output from heart will be more. Cardiac output will be more. Okay. It will pump faster. So the heart rate will be more. Okay. There could be tachycardia. Okay. So, and also the amount of blood will be more. Blood volume will be more because of hemodilution, etc. Right. So the volume of blood is more, the heart has to pump more, that is cardiac output is more, and the heart rate also is more. So all these things are more, and by trimester they are increasing 20%, 40%, and up to 40, 50% it is increasing. Okay, the blood volume and cardiac output. Heart rate is increasing up to 20% max in the up to third trimester. Okay, now coming to the blood pressure, come to this side people. This side, what do you see? It's showing negative. Something is decreasing. So the blood pressures are decreasing. Normally it should decrease. Okay, not in every woman that it will decrease. Normally it is supposed to decrease. Why? Because there is going to be vasodilation, dilatation, whatever you want to say. So what will happen when it dilates? The pressure will reduce. Very good. So the systolic pressure is reducing, diastolic pressure is also reducing. Okay, but here there's a warning. It is not in everybody that this will happen. Okay, but these are normal adaptations that are supposed to happen. Now look at what is supposed to happen to the blood vessel. So this is the blood vessel. So it is going to undergo dilatation. It's going to undergo dilatation. Okay, why? Because of prostacyclins, prostaglandins, VEGF, nitric oxide, vascular refractoriness to pressure agents, angiotensinase, which is coming from the placenta. And because of this, what is happening? The vasodilatation is happening. Let me zoom this a little. So in normal pregnancy, it is not normal me and you normal, it is normal pregnancy what they are trying to say. There will be vasodilatation causing less blood pressure. There is a uteroplacental blood flow. So not just what you and me are undergoing. There is an extra blood placenta here which is going to get the blood flow, uteroplacental blood flow. So obviously there is some kind of deviation, right? So overall what is happening? The blood pressure will reduce. Okay, platelet aggregation low, so platelets won't aggregate, that means no clot. So I think some bleeding tendency could be more. What do you see? Well, that we'll have to check. Okay, platelet aggregation is low. Okay, so vasodilation, less blood pressure, uteroplacental flow. What else you saw? Increased cardiac output, increased heart rate, increased blood volume. Okay, now coming to other things. So this we told you, heart rate is more, stroke volume is more, vasodilation peripherally. So there is a reduction in systemic blood pressure, hyperdynamic circulation, increased cardiac output. So this is the revision of whatever you saw till now. Now let's move on. ECG changes in pregnancy. So what will happen? So in the pregnant woman, what will happen? This is the uterus, let's say. Okay, this is the uterus in which the baby is growing, right? So the diaphragm gets pushed up. Because the diaphragm gets pushed up, there could be ECG changes. Okay, these are all normal adaptations. So I'm using green color. So what will happen to the ECG? When you take an ECG of this person, there is a left axis deviation up to 15 degree. Okay, so left axis deviation up to 15 degree. Let me highlight that. Then there can be a T wave inversion in leads 3 and AVF. Highlight this. T wave inversion. Okay, T wave, which is T wave here. Last here, you're seeing this T wave will get inverted in some leads. ST depression can be there. Okay, small Q waves can be there. Where is Q wave here? Q wave can be small. And sinus tachycardia. Tachycardia means what? Increased heart rate. Okay. Supraventricular and ventricular beats are common. Supraventricular and ventricular beats are common. I would like to see the ECG of this woman. Well, this sorry, this is an image that I got from internet. Maybe we'll have to sit and Very carefully analyze it. Anyways, now for exam purpose, we will say supraventricular and ventricular beats are common. Echocardiography shows modest increase in the dimensions of the heart chambers. Okay, the chambers of the heart will have some modest increase. Okay, they didn't say the heart size will increase, but the chambers they are saying will have. Oh, that is not ECG. That is echocardiography. 2D echo. They are saying. Wait, let me remove this sentence here. That is in 2D echo. Echo will show increase in dimensions of the cardiac chambers. Okay, very good. Now let's move on, people. When you check for the heart sounds, okay, with stethoscope, there could be an ejection systolic murmur and it could be normal. Okay, it could be normal. They're using the word may. But remember, if it is diastolic murmur, it is always pathological. Okay, we'll come to that. But remember, ejection systolic murmur may be part of normal pregnancy. You have to rule out always. So now we finished everything. So just we want to add a note here that not everybody is going to follow the textbook, and the pregnancy is not going to follow the textbook, right? It's not going to always be normal. It's not going to be so rosy. So basically, what is correct? Normal vasodilation. But some people will go the opposite way and go into vasospasm, and this will lead to increased blood pressure, gestational hypertension, and leading to preeclampsia, eclampsia, seizures in the mother, fetal distress, etc. because of this hypertension. So be careful. So in this video, what did you look at? Take a recap. Cardiovascular adaptations in pregnancy. So the blood volume will increase because of water retention. So there's going to be kind of hemodilution. And see, it can go up to 45% or 50%. So if you normally have 5 liters of blood volume, it can become 7 liters around, right, of blood volume. Cardiac output will increase. That is, the heart will pump more blood every time, and heart rate will increase. Stroke volume will increase. So obviously, heart rate into stroke volume will give you the cardiac output. Everything is more. Then what is less? Systolic blood pressure and diastolic blood pressure are less because there is vasodilatation. So this normally it should become less. Okay. So why does vasodilation occur? Vasodilatation occurs because of prostacyclin, prostaglandin, VEGF, nitric oxide, vascular refractoriness to pressure agents, and angiotensinase, placenta, all the effects of all these. Okay, so you just check, and then platelet aggregation will reduce. There's a uteroplacental blood flow which is taking the blood there also. Okay, so there is less blood pressure. Okay, normally it should be like that. Then we told you this one. Then in ECG, what and all you will see, because of the diaphragm elevation, there will be a left axis deviation up to 15 degree. T wave inversion will be there in the leads 3 and AVF. ST depression, small Q waves, sinus tachycardia, supraventricular and ventricular beats are common. Coming to echocardiography, there is increase in the dimensions in the cardiac chambers. Then if you hear the heart sounds, you may hear a ejection systolic murmur, which could be normal, which you can rule out. Okay, and remember, if there's a diastolic murmur, it is always pathological. Okay, and remember, not all women will have vasodilation. Some women can have vasospasm. Okay, and that vasospasm can lead to gestational hypertension, preeclampsia, eclampsia, and very complicated situations. Okay, so this is all about the cardiovascular changes in pregnancy. Bye bye.